All right, we've made it to the final, and I mean critical step of the ATLS primary survey. We're talking about E. That's for exposure and environment. And listen, this isn't just about checking a box at the end. This is where we uncover those hidden injuries and fight back against a really silent, really dangerous killer, hypothermia. So here's what we're going to cover. We'll break down the full head-to-toe exam, get into how to control the environment to stop hypothermia cold, talk about adapting our approach for different patients, and then, boil it all down to the key takeaways you can use in the trauma bay. Okay, so first up, the final survey step. Really, E is all about facing the danger of what you can't see, right? It makes us look for injuries that clothes are hiding, and maybe just as important, protect our patient from threats that the trauma room itself can create. So let me ask you this. When you're in that trauma bay, what's the biggest threat you can't see right away? Well, there are two big ones, really, hypothermia and all the injuries you just haven't found yet. That's what this step is all about. We're fighting two different enemies here. One is physiological and the other is diagnostic. And let's be really clear about this. This step is so much more than just cutting off clothes. Think of it as a 2-for-1. It's a full diagnostic exam and it's a critical preventative measure against iatrogenic hypothermia. So you're finding out what's wrong, while at the same time making sure you don't create a whole new problem. All right, on to section 2, the head-to-toe examination. Let's dig into the how. I'm talking about the actual systematic, hands-on process you'll use to expose the patient and find every single one of those hidden injuries. Okay, the process itself, it's pretty straightforward and systematic. Step 1, get all the clothing off. Use trauma shears, be fast, be efficient. Step 2, do a quick but really thorough visual inspection of the entire body. And step 3, and this is crucial, for any patient with a potential spinal injury, you have to do a careful log roll to see their back and posterior surfaces. I'm telling you, you cannot forget to check the back. So what exactly are you looking for? Yeah, the big stuff is obvious, but this is your chance to find that subtle, penetrating wound hidden in the armpit, or notice bleeding from an orifice you wouldn't have otherwise seen, or spot a deformity on the back. These are the kinds of injuries that, if you miss them now, well, the consequences can be absolutely devastating. Okay, but here's the thing. The second you expose the patient, you introduce a brand new, super critical risk that you have to manage, and that's the environment. Seriously, the moment those clothes come off, a clock starts ticking on heat loss. And get this is such a critical point. Sometimes our own life-saving interventions can actually become part of the problem. You know that big bag of crystalloids you're pumping in to treat shock? Well, if it's just at room temperature, you are actively making your patient colder. You're contributing to hypothermia and making the coagulopathy, their inability to clot, even worse, the very thing you're trying to fix. And the consequences here? They are stark. Hypothermia is a key player in the lethal triad of trauma. It's this vicious cycle, right? You get acidosis, you get coagulopathy where the blood won't clot, and the hypothermia just keeps making both of those worse. Breaking that cycle by keeping your patient warm, that's not just a nice to have. It is an absolute cornerstone of a successful resuscitation. So the big takeaway here is that preventing hypothermia has to be an active process. You can't just hope for the best. This means you warm the room before the patient even gets there. You have warm blankets ready to go. You are actively warming all IV fluids and blood products. And it sounds simple, but the second you're done with your exam, you cover that patient right back up. Now, it's important to remember that the risk of hypothermia isn't the same for everybody. Not at all. We have to be ready to adapt our approach and really heighten our awareness for certain vulnerable groups. Take pediatric patients, for example. Kids are so uniquely vulnerable. They have this huge body surface area to mass ratio, which basically means they lose heat incredibly fast. So for a child, aggressive warming isn't just a good idea. It is absolutely 100% critical from the second they roll through the door. And it's a similar story for our older adult patients. They've often lost that subcutaneous fat, which is like our natural insulation. Their bodies just can't compensate for temperature changes as well, and that puts them at a huge risk for a really rapid slide into hypothermia. Then you've got burn patients. I mean, their skin, their primary protective barrier, is just gone. This leads to massive continuous loss of both fluid and heat. And we also have to be on the lookout for those deep circumferential burns, the eschar that can act like a tourniquet. For these patients, aggressive warming is completely non-negotiable, period. Okay, let's wrap this all up. Let's boil it down to the key principles you need to take with you into every single trauma resuscitation you do. This is the stuff that really matters.
So think of this as your E checklist. It's simple, but it's so critical. First, always remember your two main goals. Find all the injuries and prevent heat loss. Second, follow the process. Remove, identify, log roll. Third, be proactive about warming. Warm blankets, warm fluids, warm room, right from the start. Fourth, adapt your awareness, right? Recognize that kids, older adults, and burn patients are at a way higher risk. And finally, the easiest step to remember, as soon as you can, cover the patient back up.
So that really leaves us with one last thought to take away. How are you going to make sure that E in your trauma bay is never, ever just an afterthought? Because it's not the end of the survey, it's a continuous process. It demands your attention, it demands teamwork, and it's how you protect your patient, not just from their injuries, but from the hidden dangers of the very room you're in.